Thank you all for being here. My name is Spencer Conover. I am currently the Assistant Director of Pasco County Animal Services in Pasco County, Florida. I also sit on the Board of Directors of the Florida Animal Protection and Advocacy Association, which is the state association for animal control in the state of Florida. And I also am the active sitting president of the National Animal Care and Control Association. I've been on that board since 2021. And I would love to talk to you all about that organization too, so please come visit us at our booth. Our executive director, Jerica Owen, is here as well. I started my journey, who's seen me present before? Awesome, it's gonna be the same jokes, guys, sorry. So I started my journey at the greatest institution of higher learning in these here United States, the University of Florida, go Gators. Get out with the Knoll chop right now, get out of this room. I wanted to go to school for sports journalism and telecommunications. I wanted to work for ESPN. I wanted to be Stuart Scott, right? So I got a job right out of college working in Denver. And you guys ever heard that phrase, you do something you love, you never work a day in your life? I had the opposite experience. I turned that thing I loved into a job, right? And I see that happen so much in this industry, right? How many of us got into this gig because we love animals, right? And we love the people that love animals. And we go through experiences every single day that turns that thing we love into a job. And coming to something like this and hearing great people that you guys will hear all week speak, hearing Julie Castle speak today, it reinvigorates you to remind you of why you do this, right? So I was working for that radio station in Denver, and my wife, girlfriend at the time, she worked at the local animal shelter. And I was like, I needed a gig. I wasn't making much money. So I interviewed for a job as the pet photographer, right? Didn't work out. But the lady that interviewed me said, he's just enough of an ass to work an intake. I was like, okay, thank you, I guess. But one day a week working there, I was getting more out of 5 days a week at the radio station, right? It's why I wanted to do this, right? I feel what you all feel, right? And so now I work in Pasco County, Florida. We're on the west coast of Florida here, right where that little red circle is right there on that screen. I figured out how to do that on PowerPoint. We are the only government municipal shelter in Pasco County. We have city contracts with all the municipalities. One of my favorite things about what I do is the people that I work with on the NACA board will tell you that I work in a magic bubble, right? I work in a magic bubble. There's only about 100 animals in my shelter right now, even though we do about 8,000 animals a year. But I'm going to tell you guys how we make that happen with the things I'm going to teach about today. First and foremost, we focus on what we focus on, right? Dogs and cats. I don't do exotics. I don't do agriculture. I don't do hoofstock, livestock. We have amazing, amazing partners that do that, right? And one thing you'll learn about Pasco County is if we're going to get a call about something, the answer is sometimes no, but it's never just no. It's no, but, right? No, but I have someone I can put you in contact with. No, but I have this amazing partner that can help you out. We have grown significantly over the last several years. I got to Pasco County in 2018, and when I got there, the population was about 420,000 people. And since then, it's now 625. Basically, COVID hit, and they said, y'all can work from home, and everybody said, I'm going to go work from Florida, right? And so we're definitely growing. We are very close to Tampa, Florida on the west coast there. We do about 7,500 to 8,500 animals a year. Our team has grown significantly. We have a $6.2 million operating budget with about 57 team members. I could do a whole nother presentation. And if you're heavily involved in Best Friends, if you go through their executive leadership certification program or their management leadership certification program, I do a course about our volunteer program and volunteerism. We have about 160 active volunteers that have over 45 different job descriptions, from not only taking care of the animals, but also working directly alongside animal control, helping in surgery, cleaning surgical equipment, recovering animals from surgery in the community. I could go on and on about that. And a lot of what I'm going to talk about today is not just limited to those 57 staff members, right? It has a lot to do with what we call team members, right? Our team members include our volunteers, and our team members include members of the public, right? That's going to be like, crazy cat lady down the street. She can't be part of our team. I'm going to tell you why she already is and how you can get her to be better, right? Also, we are very blessed. I've talked to a lot of different people. We are very blessed. We are budgeted for 2 full-time veterinarians on our staff. But we do have experience working with organizations that don't have full-time veterinarians, right? And so a couple of years ago, when I first got to Pasco County, we had what was known as a quarterly rescue partners meeting. We would get our rescue partners together, and about 15 people would show up, and they'd get in a room, and they'd yell at us and tell us what a bad job we were doing, right? Does anybody else have those meetings, right, every once in a while? So at the time, we had a pet services supervisor who's in the room today. She's also in this picture, who basically understood that at the root of everything we were going to do was collaborative partnerships. We could not do what we wanted to do without partnerships. We couldn't do it alone. I worked at a shelter in Denver, guys, for many, many, many years, and we saved thousands of animals a year. And we probably could have saved tens of thousands if we just reached out and did it with somebody else, right? If we just partnered with other people. And so in one of these meetings that they were yelling at us, they said, you guys are spreading an incredible, terrible infectious disease all around the community because you don't know what diseases are in your shelter. Right? Now, what disease was in our shelter? It was kennel cough, right? It was kennel cough. But we didn't just stop there, right? Because it would be very easy for us to go, hey, we know what we have. We don't owe it to you. But we didn't. We said, you know what? Once a quarter, we're going to do swabs of a bunch of animals in the shelter and figure out what the heck we got floating around, right? So for many, many years, we did that. And those little tiny rescue partners meetings, once again, it's a whole other presentation I could do. Those little tiny rescue partners meetings went from 15 people in a room yelling at us about what we did wrong, to this most recent one in January. We had to rent out the theater at the local library because 150 people came, and it turns into this life-saving pep rally, right? And so thank you. And so what I'm going to tell all you guys now is a lot of the stuff we're going to talk about today, and a lot of the success that Pasco County has had did not happen overnight, right? This is a long, long journey. Our organization's save rate as recently as 2012 was about 25%, right? It is now 91%. But, thank you, appreciate that. But I've sat in the seats you're sitting in and going, oh my gosh, these are amazing ideas. We have to take it back and change everything right away, right? It takes time, but you all can do it, right? And so we send these swabs out, and for years and years and years, they come back and it's mycoplasma, kennel cough, typical stuff, right? And then we finally send one out one time, and the doctor comes in and goes, hey, one of them tested positive for canine pneumovirus. And I said, what does that mean? Right? You guys will learn a lot about me in this presentation, and I hope I have not deceived any of you. When Alexis was asking me about this, Alexis Pugh, who's over the conference team, her and Rachel Hyde were asking, what is your presentation going to be about? Is it going to be about the medical side of this? Y'all, I am a medical dummy. I don't know anything about medical. I didn't know what this word meant, right? And I've been in this industry for 15 years. But I have two amazing people from my team who are going to talk about the amazing medical things that we're doing with our organization on Saturday morning. If you guys are looking at that, it's Gina Botticello and Dr. Tiffany Bogart. Please attend that session. What I want to talk to you all about is what we did when we first heard this word, right? So the first time I heard this word, I obviously said, what does it mean? And Dr. B explained what it meant. It's a highly infectious disease that runs rampant through your shelter. And so we made a phone call to this lady. Does anybody know who this lady is? That's Dr. Cinda Crawford. If you ever have this word in your shelter, call this lady. All right? Once again, if you have this word in your shelter, call this lady. All right? We are very, very blessed in the state of Florida to have the University of Florida shelter medicine team and the veterinary medicine team right down the street from us, right? But it was a phone call. You guys can call from anywhere, including here in Southern California. We called Dr. Crawford, and we said, what do we have? And she explained to us what we had. And we knew that we had to act fast, right? So the second thing I did was, you ever heard the phrase, you learn a lot more from your mistakes than your successes, right? So I looked up, and I'm not going to name any names because, guys, we've all been there. I looked up organizations that didn't handle this word very well, right? Organizations that received criticism, organizations that had animals pass away, right? And so we looked up animals that, or organizations that did not handle it very well. And the number one thing that they had in common was a lack of transparency, right? Every single time an organization was perceived as not handling this well, or handling it inappropriately, or animals passing away for the wrong reasons, it was because it was preceded with, we had this 4 months ago and we're just telling you about it now, right? We've had this in our shelter for 6 months. We didn't know what it was, so we didn't do anything, right? And once again, I'm not going to name names. It's not about who did it. It's about learning lessons from our mistakes and not our successes, right? And so what did we do next is we got we did close, but I'm going to back up. We got our leadership team together. And this is another big aspect of what we wanted to talk about today, right? Is a lot of times when you have something like canine pneumovirus in your organization, your veterinarian, someone on your medical staff will get with your director, and the two of them will come up with a solution, right? One thing I love about Pasco County is we do everything collaboratively, right? If we have pneumovirus, if we have an animal pass away, if we have a major situation, we get all 11 of these people in a room, and we sit down and say, what are we going to do as a team, right? And every single person on this leadership team is essential, except for probably me, because I'm here hanging out with you guys, and they're still doing a lot of good work back in Pasco County. But when they asked me what I wanted to present on this year, I said, one of my favorite things to do is to present at these conferences, right? I love this. And I was talking to a colleague of mine who works for Best Friends Animal Society. We were at Disney World, ironically. And I said, I've been too busy to come up with a conference presentation. We had canine pneumovirus and another illness and the hurricanes. And she said, dummy, that's your conference presentation, right? And so you get all 11 of these people together, and they're all essential. The doctors, the directors, the field staff, volunteer coordinator, media relations, everybody getting in a room and collaboratively working together. If you guys learn nothing else from me today, it's partnerships internally, partnerships externally, and transparency, right? That's what it is. So we made the very, very difficult decision. Dr. Crawford said, hey, you guys have one positive test, right? That's it. You have one dog that tested positive for one thing. Now, did we see an uptick in URI in our shelter? We did, right? And so she said, man, you really don't know what you guys have yet. Take it easy, see what happens. There's a very intense concept about, you guys ever heard of the limbic brain, right? It's the part of your brain that doesn't control speech, just controls like your gut feeling, right? It's not a real thing, but like your gut feeling. We just knew we had something bigger, right? So 2 parts of that: err on the side of caution when you can, and that comes from building strong relationships with your community, which is what we're going to talk about. And go with your gut, right? Go with your gut. We knew we had something in our shelter that didn't feel right, and we saw what those other organizations had done when they had something that didn't quite feel right, but they let it slide for a while, right? So go with your gut. So we did. We made the very, very difficult decision to close our shelter, and that could have gone very badly. If we had simply gone and put on our Facebook page, said, we have something in our shelter, we don't know what it is, we're going to close for 4 weeks. How do we think that would have been perceived by our public? Not good, right? Not good. So what did we have to do? We had to take a full proactive approach to how we were going to close and how we were going to communicate that to our community, right? So direct messaging to our community, FAQs, right? You got people that answer the phones. Have they ever come to you and be like, I'm so sick of answering the same question over and over and over again, right? One concept to that is, you guys ever heard of Lean Six Sigma? It's this process improvement concept, right? Lean stands for removing waste in your organization. Six Sigma is reducing the sigma of variation, right? Like if you ever go somewhere, this is going to be a terrible pun for best friends, but you go to McDonald's in here and you get the same thing you're going to get from McDonald's in Florida, right? It's reducing variation, right? How do you reduce variation when you can't stand over the corner of somebody that's answering the phone telling your community why you closed for 4 weeks because of a dog that had canine pneumovirus? Is you give them exactly what to say, right? Don't leave room for variation. Don't leave room for interpretation. Scripts, frequently asked questions. We sent out, so I told you the first phone call was to Dr. Crawford, right? The second thing I did was look up people that had messed this up in the past, right? And we learned from them. The third phone call was to Director of Media Relations for the county, right? It was to our PIO. And I said, Tambry, we got something going on here, and it's going to be big. I did not call any other veterinarians. I did not call anybody else. I called the Director of Media Relations for the county because we are going to control the narrative of what we tell our community, not the other way around, right? We're going to control our story. We're going to control our narrative. And so we did a press release. We came up with a press release, and I have all of these for you guys. If anybody's taking screenshots or anything, just at the end, I'll show you my email. I will send all of these to everybody. It's the state of Florida. It's all public record anyway. You guys are all obligated to it, but I'm more than happy to send it to you. We did a press release and told the community, this is what's happening in our shelter. This is what's going on, right? We did messaging to our community. We did a letter to all of our other shelter partners, all of our public stakeholders, and all of our veterinarians, right? Saying this is what's in our community, this is what's going on, and this is what we want you all to be aware of, right? So let's face it, we did not cook up canine pneumovirus in our shelter, right? Where did it come from? Came from the community, right? So who ought to know about it? Is the community, right? Pet stores, dog parks, veterinarians, boarding facilities, they have to know. They have a right to know. And if we're the organization that controls that narrative and tells them, we're on the right side of history, right? We're on the right side of that. And so we also come up with a special medical protocol, right? Animals, every single animal gets proactive care, right? Every single animal. And there's a protocol for everything. A protocol for animals that are absolutely healthy, showing no symptoms, right? We have to do something with that because this disease runs rampant through our shelter. Now, I told you guys all this, right? Contacted Dr. Crawford, looked up who did it wrong, contacted media relations, wrote a press release, did frequently asked questions, did scripts, did messaging to our entire community. That happened in the span of about 2 hours, right? So the other lesson to this is you have to act fast, right? We have to act quickly because once again, if we don't control the narrative, somebody else will, right? Social media was massive for this, right? Was massive for this. We had updates almost hourly on our Facebook about what was going on. Every time we would get another positive test back, we would go on Facebook and say, hey, we got another positive test back. It's going to be another week that we're closed. Here's why. People that didn't know, people that know us on social media, right? You have your 6% of people who follow you on social media. They love you to death. They love what you're doing. They're going to accept everything, right? You also have your 6% of people that are like, you guys need to take this dog. I don't care if you're closed. I don't care if you have a deadly disease, right? We're not going to convince those people. But the problem is we spend 90% of our time talking to that 12% of people, right? When in reality, this little Facebook Live here that gets shared 1 billion times, asking our veterinarian what canine pneumovirus is, right? We went live, Dr. B, what was it, 3, 4, 5 times during that 4 weeks? That we would just have people ask us questions. If you guys don't know what's going on, ask us. We'll share it with you, right? The other thing was transparency with those scripts is not beating around the bush, right? I went to school for journalism, and they used to say, don't paraphrase when it comes to journalism. If somebody dies, say the word dies. Don't say passed away. Don't say is no longer with us. Say they died, right? We have to be transparent with our community. The reason people bring stray dogs to our shelter is because it is perceived as being a safer place for that dog than where they currently are, right? Middle of the street, intersection, whatever it is. We had to be transparent with our community and say, we have a disease in our shelter right now that could infect this dog. This is no longer the safest place for that dog. So what do you do if you find it? No, but, right? We say, no, we're not going to take that dog, but here's all the amazing things that you can do, right? The irony is, as I'm showing you guys these blueprints of things that we can use for various crises that you go through, is this we had from COVID, right? This was from 2020, when people would call us and say, hey, I found a dog, what do I do? And we would go, I don't know, man, there's a crazy disease right now. We don't know what the heck it is. Can you hang on to it for a couple days? Well, sure, right? You would be surprised at how many of that 88% of the middle and the people in the middle of that bell curve are willing to say, yeah, I didn't know anything about that. I'll hang on to it for 3 days. Is it going to be everybody? No, of course not, right? You're going to have somebody in that 6% saying, my tax dollars pay for your job, take this dog, right? But if you can prevent 9 dogs out of 10 from coming into the shelter and getting exposed to canine pneumovirus, then you're doing your job, right? And so, success. We get through pneumovirus. It took us about 6 weeks, and we had not a single dog pass away because of that illness, right? Yes, thank you. And nothing bad ever happened to Pasco County Animal Services ever again. 6 months later, we run one of those damn tests, and it comes back with the flu. All right? Now, the flu, once again, I'm not a doctor. The word sounds less scary, but apparently is scarier than canine pneumovirus. And so we do those tests, and it comes back positive for canine influenza. So what do? We get these 11 people together. We call Dr. Crawford. We come up with a press release. We come up with messaging, right? You guys starting to see the pattern here? It doesn't matter. The reason why I was selected to do this presentation while other members of my team are selected to present on medical cases is because this is not about what crisis you're going through. It's about having your team working collaboratively together and coming up with a plan no matter what the situation is, right? It could be pneumovirus. It could be canine influenza. It could be a mudslide. It could be a fire. It could be a hurricane. It could be anything, right? You now have a blueprint in place to where you can learn from and grow from, right? We handled pneumovirus really, really, really well, but it wasn't perfect. So now we have influenza. We can grow upon that, right? So we now know we have to test. I learned this. I learned a lot through all this, y'all. These dogs, now they get the flu. It's kind of like the chicken pox theory, right? Like everybody gets it. It runs its way through your shelter. You treat everybody, and then it moves on. Well, I don't know about you guys, but without canine influenza, I'm already at 100% of my execution rate for my operating budget. I don't have the money to test every single dog in my facility 3 separate times waiting for positive titers to come back. Nor do I have the money to treat every single animal in my shelter for canine influenza. So what do? Collaborative partnerships, right? Called my buddy Kim Album at Bissell Foundation. I said, Kim, we're struggling down here in Pasco County. We helped you guys out recently with some training. Do you think you guys can help us out, right? Mutual respect, mutual partnership, right? We had sent some officers to Louisiana to help her team out. She said, absolutely, what do you need? I said, I need $10,000 to test every single dog in my facility 3 times for the next 4 weeks. And she said, absolutely, we will absolutely do that for you, right? Now, if you guys steal my next time this happens, if you guys talk to Kim before I do and you take my money, I'm going to be upset about it. But I'm not gatekeeping this partnership, right? So that was the testing. We then pop on and go on ASPCA's website, and ASPCA says, hey, we have grant funding for medical cases. So I said, I need $5,000 for doxycycline to proactively treat all the animals in my shelter. And they said, how about $3,500? And guess what? $3,500 is better than zero, right? And so before you know it, the partnerships and the relationships that we've made have now made sure that no dogs would unnecessarily die because we didn't have tax dollar money to pay for their testing and their care, right? It's about the partnerships. The other thing we did was we went one step further when it came to informing our community, right? Again, we did not grow canine influenza in our shelter. It came from somewhere in our community. And we, again, owe it to our community to educate them on that, right? So what are the signs? What do you look out for? What is canine influenza? How can I protect my pet from it? What are the symptoms? How do you get it? How is it spread? And once again, this was our use of social media every single day while we were closed again for 4 weeks, ended up being almost 6 weeks again, while we were closed to educate our community on what they can do to make sure animals aren't getting sick, right? The other thing we did was we wanted to make sure that our community understood the weight of what we were going through, right? We partner with media relations all the time to share our story. And one thing that our organization does really well is we share our story. And I saw this video made by our education and outreach coordinator on our social media. And when I was still toying around with what the conference presentation was going to be, she made this video, and I was like, that's it. That's what I'm going to do. So I'm going to show you guys a quick video. It's about 3 minutes of what we did to educate our community on canine influenza.
Flu season is here, and not just for people. If you're a dog owner, you might want to listen to this.
You know dogs can actually get the flu as well.
A surge in infectious canine influenza, the CDC describes as an acute respiratory infection.
But canine influenza.
It was caused by 2 different types of the influenza A virus.
Caused by a virus in the same family as human influenza A virus.
Dogs are susceptible to canine influenza, and they display symptoms of other common respiratory illnesses.
Now, the biggest symptom pet parents need to look for is a dry cough. A runny nose can be another symptom.
We have the flu. So what does having the flu even mean? Earlier this week, our dog population tested positive for the highly contagious canine influenza A and H3N2. Since then, about 75% of our dogs are now exhibiting signs of illness. This is a virus that looks like kennel cough, but is an entirely different beast. Signs of canine flu can be anything from coughing and loss of appetite to lethargy and a runny nose. We are taking every action to regain the health of our population, as well as educate the public on how to keep your own dog safe. We have closed all dog activity to the public. This gives us the opportunity to focus on the health of our animals, take the necessary protocols to help our population feel better, and limit the spread within our community. It's more important than ever to try and find the owner of any stray dog you may come across. We are here for the safety of all animals in Pasco, and unfortunately, with this outbreak, it's not safe to bring dogs to the shelter at this time. This virus has spread through respiratory droplets and contaminated surfaces. This can be from dog to dog or through clothing and skin. Be sure that your dog has their canine flu vaccination and that precautions are being taken if and when they are around other dogs at parks, boarding facilities, and daycares. Our cat operations remain open and are running normally. We are still here to support you with your questions over the phone, on our social medias, and through our dispatch call center. Rest assured that we are fighting for the health of not only our dogs, but the community's dogs. With dog adoptions being suspended until we are confident that we are not sending sick dogs out into the community, if you'd like to help, check out our Amazon wish list in the caption of this video. The support from our community is invaluable as we work around the clock for our pets here in Pasco.
Pretty good, right? She did that on an iPhone. No Photoshop, no nothing, just an iPhone. She edited it. It's pretty cool. I saw that video. I was really impressed. Grace did a great job with that. And as you can imagine, based on that video, based on sharing what we had going on at our shelter, based on the level of communication and partnership we had with our community, the outreach was beautiful, right? Every comment on social media was positive, was you guys are doing the right thing. What can we do to help? Prayers to you all. Thank you all for what you're doing, right? As opposed to way back in the beginning when I started, when you looked at the organizations that hadn't done it right? Hey, we're closing. We've had this in our shelter for 4 months. We didn't tell anybody. Go back and read some of the comments on those social media pages. It was the exact opposite, right? And so positivity breeds positivity. We rely heavily on collaborative partnerships. And so our rescue groups got a little worried. They said, I don't know if we're going to pull animals from you guys. You have canine influenza, right? So we partnered closely with Dr. Crawford, make sure we were doing all the right things, all the proper testing. And two very cool things happened. One is the rescue groups actually came out of the woodwork from across the state and said, we want to pull dogs from you guys because we know you're doing it right. You have dogs that have tested positive for the antibodies for this illness. They've had it. They're done with it. They won't get it again. I want those dogs in my rescue, right? By doing it the right way, by being transparent, you're now increasing those partnerships. Two, positivity breeds positivity. These are our friends from Cuddly. We partnered with them. Gina reached out and asked if they would help us. We actually held a drive-through vaccine event in our parking lot exclusively for our rescue partners. Cuddly donated the vaccines, and we vaccinated rescues, personal and rescue pets against canine influenza. Right? If you're worried about your foster-based rescue getting canine flu, come to our shelter. We'll give you a free vaccine. Once again, we didn't pay for it. Cuddly did. Right? And so the positivity that comes from that is absolutely remarkable. And again, more success. We got through canine influenza in 6 weeks, and not a single dog unnecessarily died from that illness, which is very cool. Right? And then nothing bad ever happened to Pasco County ever again. Right? And once again, I could keep you guys here for a million years. We did have the hurricanes hit. I'm not going to sit here and preach in Southern California where everybody's been through so many traumatic events over the last couple of weeks. But the effects of Hurricane Helene and Hurricane Milton in our area, 2 major hurricanes in 10 days. You know, I hit hard on unsubscribe from my Hurricane of the Week club during that time. But we got through it. Because I could go through the slides again. We got those 11 people in the room together. We communicated with our public. We got a press release. We did frequently asked questions. We closed our shelter. You guys start to see the pattern, right? Your shelter and your organization can handle anything by having a plan and working together, right? That's my information there. We got about 11 minutes left. Diane's got the microphone back there. I am happy to answer questions. If it's about a medical thing, I'm going to give you the information for a veterinarian. But if not, I'm happy to help. Yeah, go ahead.
Hi, thanks, Spencer. Something popped up in my head while you're going through all this, and this transparency is just exemplary, really great. Have you changed any protocols on the intake and ingest for quarantine?
Yeah, that's a great question. No, we have not, only because, twofold there. Canine pneumovirus, who here has had canine pneumovirus in their shelter? From what we've talked to, well, from way back in October of 2022 when that first hit, or 23, whatever it was, to now, canine pneumovirus is something we're living with now, right? And so what we've done is we have increased the amount of, or decreased rather, the amount of time in which our medical team is seeing animals upon intake, right? We can't fiscally vaccinate against canine influenza at our facility. That vaccine is extremely expensive. Also, it's rendered ineffective if not given a booster exactly 2 weeks after its intake. My average length of stay is 10 days. I've just wasted $20 on a vaccine, right? But what we can do is monitor those animals closer. I would love, love, love to be able to isolate animals upon intake. I don't have that luxury at our shelter. We have one area to house dogs. If one gets, that's how it swept through our shelter so quickly, was one got it, and y'all by day 3, 80% of our population had symptoms. And so we had to let it run its course. So we have not adjusted. I'm not against, quarantining animals, but we just have to monitor very, very closely. And we actually did so much so that in 2023, we changed one of our organization's KPIs, our key performance indicators, to animals receiving veterinary care within 3 days of coming into the shelter, to where we were now monitoring that on a monthly basis. So I can go to the medical team and I said, hey, our KPI is 95% of animals get seen within 3 days. That dipped down below 90. What can we do to make sure you guys are seeing these animals faster, right? So not necessarily a change in protocol, but monitoring it differently. That's a great question. Who else? Oh, toss it. I love it. I love that thing.
Did you allow fosters with fully vaccinated dogs to foster any? Because when we went through similar respiratory disease outbreaks, that was something that we were encouraged to do by Dr. Scott Weiss and a couple other veterinarians, that allowing them to go into foster, getting them out of your shelter, was if they had fully vaccinated dogs at home, was a better option. Did
100%.
you guys do that?
Yes, we did not do that. I will tell you that has nothing to do with this presentation and everything to do with the fact that a little girl got bit in the face from a foster dog 10 years ago, and my county's risk department does not like large dogs going to foster. Yes, absolutely. If that was an option for us, fully vaccinated, non-symptomatic dogs at home, taking dogs from the shelter, absolutely. We didn't do that, but that had to do more with our risk department and HR than it did with our organization. If you all are interested in that, there is a fantastic presentation being done at 1:45 this afternoon by Dr. Josh Fisher and Dr. Julie Hollifield about getting 2/3 of your animals into foster homes. So please attend that one as well. There was a question up here, I think, right? Yeah.
Hold up.
She's running. Diane's working today.
There you go. Who had it? Who wanted it?
I have the question.
Okay.
Yeah. It's a microphone because they're recording.
You mentioned a benefit to your transfer partners by being transparent to them and them wanting to take more of the dogs. Can you, is there a link between your potentially increased adoption rates by being transparent to the public?
Yeah, I mean, absolutely. I think when we finally opened up, we saw a massive uptick in adoption. It balances out because obviously you're closed for 4 weeks. But length of stay was huge when October 2022, November 2022, December, I don't know if it was around Christmas time, correlation doesn't equal, correlation doesn't equal causation, but the community was behind us, right? Whether it was rescue partners, whether it was adopters, we have a very open philosophy on getting animals out of our shelter. I don't care if you're an adopter, rescue, foster, whatever, you want to come take an animal out of my shelter, go for it, first come, first serve. And so the animals got out faster. Yes, absolutely, 100%. Who else? Yeah. Oh no, microphone down.
Hi.
Hi.
What would you say to, let's say, a board or a team that is apprehensive to be, where to draw that line in terms of when to be transparent and when not to? And let's say, hypothetically, in one of our opinions, we should be transparent and the rest of the team disagrees. What would you say to persuade a team that it is always in their best interest to be transparent? And can I record your answer?
Agreed. It's the concept of what's the worst that could happen if we are transparent, but what's the worst that can happen if we aren't, right? We have now broken that trust with our community. And there are organizations in our state that had this same illness at the same time that we had it, and they do not have the same relationship with their community because they were not transparent, right? And we can think that we can outsmart any crisis that we're going through, but we have found unequivocally that transparency is the key. That transparency is the key. It's the concept of what is the worst that's going to happen, is that we have now told them something that we go back and Dr. Crawford said, you only got one positive test, don't close, right? So we say, hey, we're closing for 2 weeks, and then no other positive tests come back. Hey, we closed for 2 weeks, we're sorry, we were being overly cautious. But if we didn't tell anybody, and the amount of dogs that we had test positive came back, we had 12 new positive tests within a week, right? If we didn't tell anybody, that's what can happen. That's what can happen. And we will always err on the side of transparency. Absolutely. It's a great question. Thank you. Who else? I got 4 more minutes. Or we can cut you guys to lunch early. That's my information. Jot it down, take a picture. If you guys have any questions, I am happy to help, love helping. Thank you all for coming and enjoy the rest of your conference.